Well, hello, everybody, and good afternoon, and welcome to the Mental Health Show. So you can just obviously imagine what we're going to be talking about here today. Mental health is a conversation that has been continued to grow over the years, which is great that it continues to grow. And many services are available even now through this unprecedented time. How many times have you heard the word unprecedented? But it is an unprecedented time, and many organizations have had to learn to adapt to continue to provide their services. And in effect, mental health is something that is certainly being affected by the pandemic. And what's going to happen when we come out of that pandemic? Where can you go to for yourself, for family members, to get the support that you need for mental health? Well, we've brought some experts here today on the first episode of the Mental Health Show. We're going to bring them in and let them speak about their organizations and answer your questions as well. So wherever you're watching from, if you have some comments, type them in the comments, and our experts will do their best to respond to you. And we're going to get started here right now. Hello, ladies. Thank you, and welcome to the Mental Health Show.
Hello.
Hello. Thanks for having us.
Hello.
Fantastic. Is this the new normal here, everybody? The way we meet, and are you getting used to this kind of production?
It seems to be.
Yeah, for sure. I'm sure more people are having all these virtual meetings than they thought they ever would. Let's go around the table here, and we'll let everybody introduce themselves, and we'll get to know each other. Allison Berkvens, you're from CMHA. Talk about your role and what CMHA is all about.
Sure. So my name is Allison Berkvens, and I am the mental health promotion specialist at our Sarnia location at CMHA. So at Canadian Mental Health Association, we serve both the Chatham-Kent and Sarnia-Lambton communities. We have two main locations, so one in Chatham and one in Sarnia, and we provide mental health supports for the adult population in our community. So anyone who's having any type of mental health difficulties or any diagnosed mental illnesses and need some support with that, that's what CMHA is here to help with.
Perfect, Allison. Thanks for that. And Kate McKeon, over to you. You're part of St. Clair Child Youth Services.
Yeah, so St. Clair Child Youth Services is a children's mental health organization located in Sarnia. So we deal with mental health and well-being of anybody from age 0, right from birth, up until the age of 18, as well as their families. It's a very family-oriented organization.
Yes, very good. Quick question. Don't mean to put you on the spot there. How many years has St. Clair Child and Youth Services been around?
That's a great question. It's probably coming close to 50. I know we're 40 plus.
It's over 50 years because
I'm
going to reveal my age. St. Clair Child Youth Services was a service that I used when I was a teenager.
Oh, wow.
So it's been around a very long time. So it's good to know that these services go a long way back. Shannan Bishop, you're part of a Chatham-Kent Children's Services. Talk about those services and what your role is there.
Yeah, so at Chatham-Kent Children's Services, I am a stat crisis counselor, and I also manage our social media pages and communication related to that. We are a multi-service agency, an accredited agency. We service youth from, birth up to 18. We have protection services, mental health counseling services, and developmental services all under one roof.
Very good. So all different areas of mental health being covered here today. And while some of the services are similar, there's a lot of great differences between them and covering different areas as well. We've got lots of questions that we're going to get here today, and we want to get through that as thorough as we can. But I think the first thing that comes to mind, Allison, we'll start with you on this and we'll go around the table. The pandemic has certainly created so many things, including having to adapt your services. But I'm curious to see, I've talked to other mental health experts as well, and some of them have said that things have kind of slowed down during all of this, and that actually concerns them for when we start to come out of this. Are you seeing that as well? But talk about the pandemic and how it's affected CMHA.
Yeah, so at CMHA, a lot of our services have moved to more virtual and telephone platforms because of and trying to limit the face-to-face interactions that we are having to protect both our clients and also our staff. So that has certainly changed. In the beginning of the pandemic, we did kind of see a bit of a slowdown of services. So not as many people were reaching out for support, but we have found now that we are seeing an increase of people reaching out for help, calling our crisis line, and reaching out for those mental health support. So it's great to see that people are reaching out now. I don't know if they were just kind of waiting in the beginning to see if, things were going to turn around more quickly. So, but now it's getting to the point where they're getting that they need to reach out for that support. So we always like to encourage people. It's never too early to reach out for help. So we would like to get those calls earlier than later.
Right. So I guess when you receive the calls, it's somewhat comforting, because I guess that sort of sends the message that people are aware of you, right?
Mm-hmm. Absolutely. Yes. We would love for people to reach out again if they're just feeling very overwhelmed and stressed with the situation that we're in right now because of the pandemic. Certainly, our social situations have changed. Some people, their work situation has changed. So there's more stress, could be some anxiety and depression, which is very understandable during these times. So certainly we are happy to answer those phone calls if people are needing some extra support right now.
Very good, Allison. Thank you. Kate, I'll move over to you with the same question. How's things adapting there, and what concerns have you seen? And I'd like to add into that, are you seeing people maybe that haven't used the services before that are now reaching out and saying, wow, I do need this?
Yeah, absolutely. So it's interesting because a lot of the stressors or common things that we help young folks with, when you're staying home and you're isolating, let's say you're dealing with anxiety and transitions are very difficult for you, or being around other people, those young folks we've seen are feeling significantly better when they're completely not having to deal with those stressors on a daily basis. But then you have the other folks who the isolation and the whatever's going on at home and the disconnection and the lack of structure in a day. We all know that kids and young people thrive in structured environments. And so having no structure, it's okay for, a week, a couple of weeks, but as time goes on, you see that those challenges start becoming more apparent. And you start seeing a lot more parents reaching out, struggling with behaviors and interacting when we're all confined to a household as a family with, kids and parents, and, it's a bit of a different situation than what we're usually used to. We're having to adapt as families differently, and some struggle more than others to do that effectively. So we as an organization have worked really hard to adapt to what we're seeing coming through the door, so to speak, right. Metaphorically, and using virtual services to try and just meet people where they're at and support them as best we can.
Very good. And Shannan, over to you. I guess the same thing. How's the pandemic affecting your area?
Very similarly to what Allison and Kate were speaking about, Chatham-Kent Children's Services has experienced much of the same. We are definitely have moved more to a virtual model. So that's through video and phone conversations with families and supporting that way. We have tried to also offer some virtual drop-in style groups for children and youth in the community, and some parent support groups as well. We found initially our referrals were down quite a bit. We do see that those numbers increasing as the pandemic has gone on, and much like Kate said, as more families are more continuing to be isolated and on their own, they're definitely now starting to reach out for support. It almost looked like people were just kind of waiting it out for those first kind of 2 to 3 weeks, and thought that maybe after that things would kind of go back to quote unquote normal. And after they realized that this was kind of more of the long haul, they decided that they were going to continue to reach out in the ways that maybe they did before.
Yeah. Well, and I guess as I go back to, I said, I've talked to several mental health experts, and it was kind of concerning for a while how, I guess, quiet things were, because is that the calm before the storm, so to speak, and we don't really want to see that storm in so many ways. I'm sure there's, the word mental health. I mean, there's so many directions that conversation can go. It sounds like we're seeing some more unique situations for mental health because of the pandemic, with different families, and, everybody's got, separated families, together families. There's just so many different scenarios that are out there. Are people adapting well to the services and the way that they're being delivered now that, the organization has had it out? Are they receiving it well? I'll just continue on with you there, Shannan.
I think now families and workers alike are becoming more comfortable with the virtual platforms. I think initially that was a big transition for all of us. I think, now we have our families who, let's say, referred for service even before the pandemic happened and have been in services and are used to a face-to-face interaction. It was definitely a challenge to kind of flip over to that virtual platform. But I do feel like now we've kind of settled in, if you will, to kind of a routine, and everybody's kind of becoming more familiar with how to use those things.
Yeah, it's a whole new world.
Mm-hmm.
That's
and I don't think
now, right?
Well, and we've talked at our agency, we're likely not going to be able to go back to a model that doesn't include some level of virtual service, because at the end of the day, we're finding that it does meet the needs for some. And there were barriers there before, whether it's, finances or transportation, etc. Yeah. And now those families are able to access without those barriers, right?
Yeah, which I guess in a way of looking at it is it's a good thing to be able to offer more of those services and in different ways. And I think even people, the way we work is all going to change as well. There are some things maybe you'll be able to do more work from home, that sort of thing. Kate, I want to come back over to you. More on the family side. You're obviously doing the virtual as well. What about the counselors that are providing these services? Has there had to be additional training on how to do this virtually?
Absolutely. A lot of our staff have done a lot of really right from the get-go of us closing the physical doors of the agency. There was training made available to staff to help them increase not only their competence, but their confidence in providing services virtually. As clinicians, we read so much about a situation that does not have to do with just the words that are being said and the tone of voice, which when you're on the phone is really all you have to work with. We read body language, we read interactions between family members, all of those types of things. So having to adapt and adjust to those things required a shift in the way that we view things and an increase in our ability to find different ways of doing that. It has become a little bit easier since having video conferencing available to us. That's one step closer to what we're used to than just a phone. But absolutely, it does take some extra learning and wisdom and education to be able to feel comfortable to effectively offer virtual services.
Yeah. And I would think that there's a relationship thing that happens between, maybe somebody who's using the services more than once kind of thing, or coming back regularly. We're not in the same room with a person anymore. And I guess that relationship intimacy, is that a fair word to say, between the counselor and the person needing the services, that's been a continuous obstacle. Anybody jump in on that one? I'd like to hear that.
I think it It can be. I think it's different depending on whether or not you have, it's a client that you have worked with for a period of time versus a brand new client. And I think it's far from impossible to build that rapport and to create that relationship, but it's different, and it might take a different amount of time than it might when you are sitting 3 feet, 4 feet away from somebody in the same room.
Yeah. And I'll put this out to all of you as well. What about the trust factor as far as security goes on delivering virtually? Has that come up, or has that been an issue, or has that been handled?
It's come up at our agency in terms of, are you referring specifically to even just the confidential nature of discussions and just the kind of security around that?
I would think a little bit of both, because there could be somebody else in your room right now while we're doing this, and I can't see them and I don't know that they're there. Trust issues, and then I guess even virtual security issues is what I'm talking about as well.
Yeah, so for us, I mean, it kind of comes back to the discussions that we would even have in person just around consent and informed consent in general, to, agreeing to and understanding what mental health services are all about and the purposes for utilizing those services. And so we try to kind of just have that conversation with families, whether that's caregivers, children, or youth, who's in our space, where we are, and that it's private and there's no one else there. And, for them to understand that whoever's in their space is going to hear and possibly see what's going on, and to be aware of that, and just to do like a check-in almost at the beginning. And of course, like anything, the more familiar you get with the process, then you kind of start to know and pay attention and make decisions about what you're comfortable with.
Right. And Shannan, directed to you as well. So I have a young child with me, and parenting's not an easy task, right? To recognize issues. Sometimes we don't recognize those issues, and we want to recognize those issues. How do I know if my child needs maybe your services?
It's a really good question, and I think if any parent is ever concerned or has a question about typical behavior or typical development type questions, they're always welcome to call in and have discussions with our intake team to kind of learn more about that. I think, if you're noticing frequent, persistent, reoccurrent kind of mood swings or behavior challenges that maybe weren't there before, or they're more extreme or more intense than they were before, those are good indications that maybe there's something going on. And so just that change in kind of typical baseline behavior, and being able to kind of recognize that and reach out and start the process and ask for help and maybe get a chance to see what's going on. Kids have a unique way of showing their feelings, and sometimes that's through, ways other than talking and communicating. Right.
Thanks for that. And we did share the information up on the screen there. We'll be showing information about all of our organizations here. And I think the key word in all of this is ask for help. However, that's not always easy, right? Allison, I want to come over to you and talk to you about that. Let's talk about the stigma that goes along with mental health. I've often said we need to stomp the stigma and get rid of that. And I think we've been progressing over the last few years with that. Seems like we've got a long way to go. Why? How do we continue to overcome this? Are we headed in the right direction?
I think we certainly are headed in the right direction. Like you mentioned, the stigma around mental health has certainly gotten a lot better than it ever has, but I think you're right in that there is still a lot of room to go, a long way to go. I think the most important thing is just talking about it. So having these types of conversations about mental health, about, one, to recognize when somebody is struggling with mental illness, so then you can either ask for help or at least see it in somebody else that maybe they need to reach out for help. So asking them if they're okay, is so important as well. So I think really just the education around, what it looks like when somebody is struggling, the services that are available, so that if you do get to that point where you do need help, you know how to access that support, and you know where that support is available, and the right phone numbers to call, I think is really important as well. But yeah, I think, again, the most important thing is just creating more awareness around mental health and mental illness. These are real difficulties that people do struggle with, and it is something that can be treated, certainly, and that there is resources and there is services available to help people who do struggle with their mental health.
Yeah. It's hard to ask for help sometimes. Why do we have such a hard time asking for help? Like, I even refer to like children, like they don't even like to ask for help with their homework because they don't want to sound stupid, right?
Mm-hmm.
And we don't want to put our hand up because we might look silly or whatever that is. So I guess that's something we really need to work on is we got to take this and put it aside on that part of it and just go, okay, I really need some help here. And it seems like more and more awareness, even through things like what we're doing here is coming to it. But like I said, long way to go. This is probably a question that everybody can answer. But Kate, I'll come back over to you and let you start with this. Okay, so I've decided I need help, or my children needs help, my family needs help, whatever that looks like. And I'm okay with asking for the help. But what about the money? I don't know if I can afford this because this real profession that I'm seeking out has got to be costing a whole lot of money. Does it cost me to come to you?
Absolutely not. There's no service that we offer that is associated with any types of fees. I'm guessing it's probably quite similar to the other two organizations as well. We're funded in different ways, but generally there is some ministry and some municipal funding that goes into mental health services. And so it costs, or the idea of fee for service should never be a barrier for anybody seeking out mental health services. There is always something available in the community, and just picking up that phone and making the call to make that connection, we can help problem solve any concerns. And Shannan had talked about the barriers that exist sometimes, that the virtual has helped with some of the barriers like transportation. And those are realistic because although our service doesn't cost money, time off work or gas for the car if you live out in the county, all those types of things. So those are things that we often problem solve with people and try to find solutions to ensure that they're able to access our services if they are in need. Right.
Shannan, same thing?
Yeah, that would be the same for us. And again, Chatham-Kent, it is quite a large area to cover in the outskirts of town and the different kind of areas within Chatham-Kent. And so we do typically, now the COVID pandemic is a little bit different, but typically we would also travel to those other centers to see families. So like drive to Wallaceburg or Tilbury or Blenheim to just alleviate that need to travel and for gas money and transportation and things like that. Our services are all free as well.
Wow, fantastic. Allison?
Same at CMHA. We don't charge for any of the services that we offer at our agency. And also we try to help eliminate some of the barriers that can come along with accessing services. So our team is very mobile as well. We try to reach everybody because Chatham-Kent, like Shannan said, is across a large area, and so is Sarnia-Lambton. So we do have some staff that are stationed out into the smaller, more rural communities, but everyone on our team is, most people on our team are very mobile. So we try to come to individuals out in those smaller communities if that makes it easier for them to access these very important services that they would need.
Yeah. Well, okay, that's good. I think that brings down a lot of barriers for people to. Money's always that root of preventing us from doing things, right? So, okay, so let me paint this picture. So we're talking about families and we talk about our children, and then what about an individual, for example, who lives on their own? They're by themselves. Maybe they don't have any family around or people to reach out to. How how are we keeping in touch with them? That I know that's difficult, I'm sure. Like, how do we recognize that person, and how do we approach it? Because I don't know if I could go up to somebody that I know and go like, "Are you okay?" and sound, not to prevent embarrassment, that sort of thing, I guess, as silly as that should be. But how do we connect with those people?
That's a great question. I think that speaks to the way that our culture has kind of moved into being much more individualistic and isolated, and we're a lot less community focused, and we're a lot less likely, like you said, to just strike up a conversation with somebody that we don't know. But you bring up a great point that there are people who are isolated and disconnected from other people, and sometimes those simple conversations, even those, "Hey, how's it going?" as you walk past somebody, it can make a difference in somebody's day. So maybe it's just about us increasing our awareness of that and making more of an effort to connect with people just on a general level.
Yeah.
And I think a key too, and I know, as our agencies are restricted right now due to the pandemic, but I know at KICS, Chatham-Kent Children's Services, we try and offer such a wide variety of services because not everyone fits into the same mold or has the same kind of strengths or interests. So we try and run groups, we try and do individual work. We have drop-in kind of mindfulness and yoga type things. Like, we try and embrace all treatment modalities and all like across the board, just to try and meet the needs of each individual.
Well, that's good to know. And sorry, Allison, go ahead. You were going to say something.
Yeah, I was just going to say as well, that's why at CMHA as well, we provide that 24-hour crisis line, because again, it's for those who are on their own, they might feel comfortable if they're able to, call any time of day, any day that they need. And then normally under regular circumstances, we do provide just walk-in supports as well. So if, they do feel comfortable enough where they can walk into our agency and talk to somebody and receive that support, then that's what they're for. So we try to make it as easy as we can for individuals who are struggling to get that mental health support that they need.
Right. Sorry, Kate, were you going to add to that?
No.
Sorry, okay, I thought I heard somebody. Well, this is great to know that all these services are available. Their services are available. Let's talk about the services that are available. Allison, I'll continue on with you, and then we'll go around again. What specifically services are available? And I guess what makes everybody here a little bit unique from each organization is probably a good thing to understand as well, because I don't think we want people to think there's all this duplication going on out there. There's something unique happening here. So Allison, let's start with you.
Sure. So as I mentioned a little bit in my introduction, at CMHA, we provide mental health support specifically for the adult population. So we do focus on the 16 and up. And we offer really a wide variety of different services to support individuals who are struggling with their mental health. So we offer anything from brief services into more longer term supports. So we do offer crisis supports, as I mentioned. We have that 24-hour first response phone line that people can call if they're in any need of mental health supports. We offer counseling services. We do offer some psychotherapy. We help with housing. We offer some family support at CMHA as well for family members. Really a wide variety of different types of services to help individuals get to that state of recovery where they feel well enough to live independently with their mental illness.
All right, very good. Kate, and what can you tell us a little more specific? What kind of services specifically is St. Clair Child Youth offering?
So similar to what Shannan had just mentioned in their services, we offer a variety of kind of modalities. So we have individual, we have groups, we have workshops, we have parenting supports as well as supports for young people, and then the variety, like Allison had mentioned as well. So we have single sessions of therapy, which a lot of times if somebody can get in and do a little bit of problem solving and have somebody to talk to, it can be really effective to help them out to deal with something very kind of acute and specific. All the way ranging from kind of mid-term services to long-term. And you don't get slotted necessarily into one and then you're there. It's if you are in one type of service and you need something else. We also have services that go into people's homes. A family solutions type model where a worker comes into the home to help in the moment and in the kind of thick of things to help process. And then in the community as well. So we try to be as adaptable and diverse as we possibly can to try and meet the needs of the folks that we're serving.
Right. And I wanted to add this question in there, and Shannan, this will be something for you to think about as well when I come to you. As large of an area as you're covering, and I'm thinking Sarnia Lambton because this is where I'm at. As large as it is, it's a small community. And people know each other, or we recognize faces of each other. Now, I know the answer to this, but I'm hoping you'll put this out there too, so that our viewers understand the confidentiality side of things, because some people in our community might go, well, I'm going to walk in there and everybody's going to know me, and I don't want to know all that, and then the stigma starts. Even though the person that's looking at you is sitting in the same place, we still tend to do that kind of thing, unfortunately. How do you handle that? I see you smiling, Kate, when I bring this up. So this is obviously something that's been run into.
Yeah, I mean, Sarnia is a small community, and we cover a lot of space, but it is not uncommon to see people that you know when you come to the agency. And that's a conversation we have with every single person and every single family from the get-go and from the start. We also do things to try and make people feel most comfortable, right? So if they come in and our kids play hockey together, and so we run into each other, we'll have that conversation. Are you comfortable with me as your counselor? Would you like somebody else? And that is like absolutely fine. Sometimes the decision is made. My family doctor comes in with their kid, and I say, you know what, this isn't appropriate, or this crosses some boundaries. So sometimes it's really clear, and sometimes it's up for discussion. And then doing simple things like in the community, we as staff would never approach or even really wave or acknowledge somebody. If somebody that we're working with professionally wants to come up and speak to us, that's absolutely fine. But we would not initiate that, because we don't ever want to put somebody in the position of having to explain to somebody else who we are if they're not in the position to do that.
See, I'd have a hard time with that, because I'd still want to say, how you doing? Right?
Yeah.
I get that. But it's good to know. And I think people, as obvious as it might seem, the whole confidentiality might seem in all these organizations, I think it's just a good reminder to continue to put people's minds at ease that it's okay. And we have you at mind here, you and your family. So that's good to know. Shannan, let's continue on with you and a little more specifics about what's available with your services, and then maybe kind of answer the same question there.
Yeah, so we have, like I said earlier, we have a few different services all under kind of the KICS umbrella. And so we have our mental health services, our developmental services, and our protection services. And so we each kind of operate independently, even though we're all under the same roof. So we all have to adhere to our policies and our ministry guidelines and all of the ways we kind of do business, which are not all the same just because we're in the same building. So mental health specifically, we have our brief walk-in services, our single session walk-in. We also have our Brief in 3 program, which is a brief treatment model where families can access 3 intensive counseling sessions to focus on a specific goal. We also have our SCCYS counseling services. They are immediately available to families kind of in higher risk situations. So children and youth that may be self-harming or thinking about suicide, or where safety is a concern. So those are time limited services, but they are available without a wait list. We also have our longer term counseling services, and that can range in time frame from anywhere from 3 months to 6 months, or longer in certain situations. We also have our groups that we try and run, our parenting seminars that we try and run. And like Kate said, we also have a program, our family intervention program, and they go into homes when they're able to, obviously with the pandemic. Not right now, but they go in and do that hands-on kind of modeling and, help establish routines and consistencies at home, more of a parent support, caregiver support. We also have our mindful moments group that focuses on grounding techniques and mindfulness and yoga. So again, we're really just trying to meet the needs of our community and kind of offer a variety of programs in our mental health department.
Right. And do you run into the same situation like I was talking with Kate there, where people come in and they know each other and then they go out to the hockey game or whatever and, oh, hi. Right.
Yeah. And those are conversations that, like Kate said, we have those conversations right at the get-go. Those conversations start at the intake level, and move on from there. So it's about, having those conversations that you may see someone in the lobby. Chatham's not a very big place. You may go to school together, play sports together. Just reassuring families that we maintain that confidentiality and information doesn't get shared with anyone without permission and signed consent. And I always like to frame it to kids too. You can tell whoever you want that you come here for services, and you can share as much or as little as you want to about that. But as your counselor, I'm not able to tell anyone. So much
Right.
like Kate was saying, we wouldn't walk up to a family that we were working with at the local Walmart and, initiate a conversation. Now, I have had kids over the years, especially the little ones, that they see you out and about and they can't wait to come over and give you a hug, and they, it doesn't matter to them. So you deal with those situations as they come up, but it's always about respect for the families.
Yeah. All right. Well, let me add this one in. And I think this is probably more to the family services side of things. What about mom and dad? So my young son is 12, 13 years old and comes to you and you say, I'm not going to tell anybody anything. Now we've got that child there that maybe is afraid. Are you going to tell my mom and dad what I tell you? How does that work with confidentiality? Because as the parent, I know I want to know, right? But then maybe sometimes mom or dad shouldn't know. How do you deal with that?
At our organization, the child is our client. So what the child wants is what we will do. So if they want one parent to know and not the other, it can be very tricky. Working with families is complex. But the key is building trust with the young person. So if they say, I don't want you to tell this, caveat is safety, obviously, that trumps. But if it's not a safety concern and they don't want that shared, if I go ahead and share that, my ability to support and help that young person moving forward is highly compromised. And that's something that we really help parents to understand, is like, we're trying our best to help the young person with where they're at. And we're always working towards getting the young person to a place where they're comfortable bringing their parent in, if that's appropriate, because max, we're a blip on their life screen, right? And their parents or their important people in their life could be a huge support to them if we can help them understand and if we can help enlist them into the care plan. So we will always respect a young person's wish not to share information as long as it doesn't have to do with safety, but we'll continuously generally work to try and see if we can build a bridge there to create that support.
Yeah. Well, because I guess at the end of the day, to not have to come back for services anymore, really, right? If you can start to handle some things on your own or better, etc. Shannan, could you add to that?
It's very similar at our agency. The child or youth is our client, and we adhere to confidentiality, and we definitely keep things private, especially if that's, if they don't want that information shared. We would never share it. We're very clear kind of upfront with our mental at the intake level again and during those first few sessions about what it means when there's a safety concern. And that can mean, maybe concerns about child abuse and a duty to report to protection services. That can mean, maybe a child or youth has expressed, concerns about thinking about suicide or self-harm, in which case then we would bring a parent or a caregiver into the picture because we need to ensure safety. And so like Kate said, safety trumps everything. If there's safety concerns, unfortunately, confidentiality goes out the window at that point and you have to deal with the safety. Yeah.
Yeah, totally makes sense. Well, and that you sort of covered a bit of one of my next questions for you, Shannan. Sharing information with other organizations and services, like Child Protective Services, for example. I would imagine in certain situations you're maybe dealing with police services or medical services, family doctors, that sort of thing. Is that all handled in the beginning as to people agreeing to that, or what does that look like?
Yeah, and it's a really good question specifically related to our agency, I think, because we are having so many services under one roof. And I think sometimes the assumption is that all of those services are one and that information is just, kind of shared without any thought. And it's just a given that if you're coming for mental health services, you're obviously then having information shared with protection or another service in the building. And that's not the case. Like all professionals, we have a duty to report if there are safety concerns, obviously, but typically that information wouldn't be shared without very specific permission and assigned consent from the family to do so. So, it's important for families to know that, because I think, there is a little bit of anxiety sometimes or apprehension around where their information is going and who has access to it. And rightfully so, it's private information. Yeah.
Good to know. Good to know. And the safety thing, I think anybody could understand that for sure. Right. Mm-hmm. So that's a good point to put out there. Wow. The conversation has gone on so well here today. And we just got a couple more points that I want to get to before we wrap up. And this is one that I'm going to come back to Allison, because we've had her quiet for a little while. So we'll come back. Allison. Okay, all these services that everybody's offering are fantastic and free, and there's a lot of good information here. I've decided I need some assistance. How long do I have to wait to get your services? Is there a waiting list?
So for our services at CMHA, how it works for those who are interested in getting support is they would contact our mental health first response team. And then from there, they are kind of flowed into the appropriate service. So depending on what their mental health needs are and what services they require, they would be flowed into that appropriate program that we would offer. So there can be some wait list for some of our programs. It really just depends on what service that they need and what the situation is at that time. But how it works is once they contact our mental health first response team, that worker sticks with them until they are into the next appropriate service. So they're never without support at CMHA. If they are put on a waiting list for a specific program, they still have that connection to that initial worker that they called with and spoke to on the phone, or if they walked into service, they're still connected with that worker until they are in that next program or that specific service that they were looking for.
All right. Very good to know. Thanks, Allison. Kate, same over to you.
I think our services follow a fairly similar pattern as some of the ones that Shannan mentioned. So during normal times or non-COVID times, we have a walk-in clinic that happens twice a week. So that's on Tuesday afternoon evenings, and then Thursday mornings. So, and it's like a doctor's walk-in clinic where you and the family or the individual comes in, you will be seen that day if you're there within the kind of time constraints that we have. So at no time would you have to wait any more than a week to see a counselor. And then we have the brief services as well. And so that doesn't have a wait list either. If you need ongoing or more intensive long-term services, depending, kind of like Allison said, it's going to depend on what's most appropriate for you as to where you're going to be streamed. And some have longer waits than others. But in the interim, let's say you're put on a wait list for one of the programs that has a little bit of a longer wait to it. There are other programs you can access. There are workshops, or there's the walk-in clinic. So if you're struggling to cope, then you come back.
Perfect. Shannan?
Yeah, our situation is very similar to what Kate was saying. We have our walk-in. Now, typically our walk-in would run twice a month, but throughout the pandemic, we've expanded our walk-in hours, and we do have walk-in appointments available daily via virtual platforms. So families can access our single session walk-in without a wait. Our STAT crisis counseling services, like I mentioned before, there's no wait for those either. The response time is usually within 24 hours. Our longer term services, unfortunately, there is a wait list for those services, and the time to wait is really just dependent on each specific family's situation. They take into account the needs and, try and prioritize, how long people have been waiting, like looking at a lot of different factors. But we do try and have other services like our drop-in groups, which a lot of them are running virtual right now, and things like that, just to kind of get that support in the meantime while you are waiting.
Perfect. Well, this has been certainly very informative, not only to me, but I know that our viewers who are watching here today. And I think it's important that we're doing this and talking, just another way to connect with people here on the Mental Health Show. And by the way, thank you all for the services and the work that you do to continue to help people, not just with regular situations, but now with the pandemic that's going on. Thank you very much for all of that. Just before we wrap up, I'm going to come back to each one of you and just maybe give you one last chance to put anything out there that maybe we've missed. Allison, we'll start with you.
Sure. So again, if you need any type of mental health support for yourself, don't hesitate to reach out for help. Feel free to call our first response team. As I mentioned, we are available 24/7. So any time of the day, any day of the week, we are available to answer your call. Again, earlier is always better. Don't have to wait to the point where you get into that crisis mode. Feel free to reach out if you are in any type of struggle and need any type of support. CMHA is always here for you.
Very good. Thanks, Allison. Kate?
I think it's important to note that mental health services are not just for people who have a diagnosed mental health concern or a serious, quote unquote, mental health concern. It's if you're struggling, if you notice your kid's struggling, if you as a parent are struggling with your child, then give us a call. We will talk you through as best we can whatever's going on. We will see what we can do for you. You're not alone, and I think it's important that if you're concerned or if you're struggling, that you just reach out, and we'll go from there. Very
good. Thanks, Kate. Shannan, we'll finalize with you.
Yeah, I think similarly to what Allison and Kate were saying, we're here. We are happy to help, and it's really important to remember you're not alone. There's no silly questions, and needs can vary in severity, and one's not more or less important than the next. So if you need support and you have questions, by all means, we're here. We are open. We've been open through this entire pandemic, and all of our services are happening virtually, and we welcome you if you're looking for that support.
Very good. Thank you so much. And thanks once again to all of you. And thanks to all of you, the viewers, for joining us here today. This has been the first episode of the Mental Health Show. No reason to be alone out there. If you're watching this, take advantage of the services. And if you maybe know somebody who could use these services, or you're just concerned for somebody, click that share button, share it around. Let's spread the word that these services are available for everyone who needs them, no charge, and can get you looked after right away. Thanks again to all of our guests. Keep an eye out. We'll be having more episodes of the Mental Health Show. It's been my pleasure to be your host. I'm David Burrows. Until next time, take care and remember that you matter. Bye for now.